certainly
Billion
within the
dollar
realm of
idea.
possibility.
I've thought about versions of this before where you just like you just basically as far as like lipo robot, you just lay down, the tools go inside, and they know exactly where your anatomy is. As long as you don't move, you probably won't get skewered, and then it just melts the fat perfectly into the shape that you want, and then you get up and go home.
Well, wasn't radiation oncology done in much that same way?
Yeah, and
Right,
like LASIK. I think Neuralink is heading that direction.
Yeah.
I talk about this every surgeon I meet. I kind of I like to poke the question a little bit, because the two areas that I think are somewhat safe for longer but not forever is trauma surgery, and I actually think aesthetic surgery is safe. Aesthetic surgery, because there's no like universal gold standard about this is what looks great.
Yeah,
right.
And there's just the training data is garbage. Like you don't have thousands of hours of videos of people doing aesthetic surgery, and the trauma surgery, the data is not that much, and it's also like you don't have like you can't take an hour to try and stop massive hemorrhaging from somebody's liver or something. You know, it's got to be quick.
That's true. Yeah. I think A to Z procedures are easy to replace, theoretically by a robot than ones that involve, as you said, aesthetic judgment, require proper aesthetic eye. I mean, that's the human element of things, right? It's like, is your concept of beauty is an amalgamation of like everything you've seen in your entire life that is indicated to you that this is the way something should look.
Yeah, and we all have like a different style on what we think is nice. And that's kind of when patients come to choose us, because they're like, I like that style of nose, I like that style of boob, I like that style of butt. So they come to see you for that. And like a robot, but a robot could also have that style.